You need a cervical check just because you're 36 weeks? Let's talk. Hey moms, I'm Dr. Shaunna Mason. I'm a board certified OBGYN practicing here in Houston, Texas, here to educate all moms about your bodies getting ready to have your baby while you deliver and while you recover with your newborn. So let's get started. So lots of you will be asked to get undressed at your 35, 36 prenatal appointment. And it might be a little bit of a surprise because you've been seeing your doctor for weeks with all your clothes on. And now all of a sudden there's this gown and you've got this big pregnant belly and this, medical assistant, this lovely gal that you probably gotten to know well with your provider, is telling you to get undressed waist down. And most of you may not be prepared for this. And so let's talk about what it really is, should you get one, and what are kind of the pros and cons. So around the time of the 35 to 36 week visit, we need to do some last bit testing to make sure that we are prepared to have a safe delivery both for you and your baby. And one of those things is known as the GBS swab, or a swab that looks for bacteria that lives naturally in our body, known as group beta strep or GBS. Now, 1 in 5 women will test positive for this. So that's 20%. In our medical world, that's a pretty good number of us. And this bacteria can be really challenging for our babies to be exposed to and then manage as they are coming into our world filled with all of these new exposures, these bacteria, viruses, antigens, all these things. They've been living in a really sterile environment in our bodies. And GBS is one of the things that can actually make them really sick if they get exposed to it. It can give them blood infections and lung infections and be really, really dangerous. So we have the ability to screen moms who carry this bacteria naturally on our bodies so that we can give you antibiotics when you are in labor to reduce the chance of your baby getting exposed to this. So because you have to get undressed for us to do this vaginal swab, it's a good opportunity for your doctor to offer you a cervical check at the same time. So let's talk about the cervix, where your baby is, and do you benefit from a cervical check at this time? So here's my trusty pelvis, and here is my Play-Doh cervix, which I think is a good way to demonstrate cervical dilation and thinning as we learn more about our bodies. So our cervix is sitting back here in the back of the pelvis, inside the vagina. Obviously, that part isn't depicted here. And on top of that is hopefully our baby's little head, right? And so all of this is inside of our pelvis. We're laying on the table. Cervix is here and our baby's head is here. So just to give you some orientation, if you were standing up, it would all look like this. And here we are, okay? I'm gonna sit down the pelvis and we're gonna focus just on our Play-Doh cervix and our baby's head. Okay, so as you can see here, this is if we're laying down, there is a little dimple or divot inside the cervix that is called the cervical os or the cervical opening. And this is what actually opens or dilates as you get closer to being in labor. So we can feel with our hands, with our fingers, to tell how dilated moms are in the office, right? So as our bodies get ready for labor, the cervix both shortens or effaces and dilates. So things that help with that are chemicals that our bodies release, things like the hormones relaxin and oxytocin. Other chemicals known as prostaglandins help the cervix prepare itself to both thin down or efface and dilate. Now, not to mention this not so little nugget anymore, and gravity are pushing down on that cervix all day as we walk and move. And these baby contractions known as Braxton Hicks start. And so all of these things working together are what cause the cervix to slowly shrink or thin and dilate or open, right? And then we can feel that. And eventually, when we dilate enough, we can feel our little baby's head sitting on top of that through a vaginal exam, and that can tell us how dilated we are. Now, let's get back. So that's what a check is, and that's what we're looking for, and that's what dilation means, kind of on a big picture scale. But do you really need one at 36 weeks? And the answer is maybe, but it's really up to you. So dilation does not tell us the whole story about how your body is getting ready for labor. It's a combination of contractions, how often they're coming, how strong are they, and how dilated you are. That means that you could be dilated in the office and be pregnant for several more weeks. It also means you could not be dilated in the office and be in labor that night. Our bodies are really amazing how they respond to these things, how quickly things happen. And honestly, we don't have a ton of control over that, right? Otherwise, everyone would kick themselves into labor exactly when they got tired of being pregnant or exactly when they wanted to have their baby. We would love that if we knew exactly we would be able to tell you when you're having your baby. But the truth is, there's lots of dynamic factors at play, and we can follow cervical checks in the office to kind of help you understand what you're feeling week to week at home if it's leading to some progress. But please, please, please don't let this defeat you, right? Because again, you could be dilated to 3 or 4 centimeters and pregnant for several more weeks. You could also not be dilated at all and your water break and be in labor that night. So, dilation in the office from a cervical check does not tell us the whole story. So the truth is, it's up to you if you want a cervical check, right? If you find that information valuable, if you have had a baby before your due date before, maybe you went into labor with your last baby at 37 weeks and you were really caught off guard and surprised by that. Maybe knowing how dilated you are at that 35 or 36-week visit may help you gauge whether it might be happening the same way this time. If last week you weren't feeling anything and this week you're feeling contractions on and off all the time, where sometimes you're up monitoring them, thinking that maybe labor is starting, maybe you do want to know if you've started to dilate or if you've made any change from the week before. But I think this is true at those visits leading up to the end of pregnancy, that it's really your choice if you want to be examined. And I think more and more providers are moving in that direction, right? It can provide us valuable information, but also it's just one marker, right? It's just one metric that we can use to help you understand all the changes that are happening to you at the end of your pregnancy. One time I do think it's really important to consider a cervical exam, even if maybe before you weren't really considering them, is if you are thinking or needing to be induced, right? Knowing what our starting point is, how close we are to the finish line of 10 centimeters is really good, as your doctor needs to develop a plan and strategies and discuss the tools she may need to use to help you have this baby. So that's when a cervical check actually can be really important for both you and your provider. Otherwise, it's there to help you. So talk to your doctor. Now you know what to expect. If they ask you to get undressed at 36 weeks, you still probably need to get undressed, but it's okay to ask whether she recommends an exam, whether you think you want one. They are uncomfortable. We are, having to put our hands in there. Everything's a little more sensitive, a little more swollen at the end of pregnancy, but it doesn't take long, thankfully. And if the information that you could gain with that check brings you some reassurance, some more knowledge about your body, then it's definitely worth it. But again, totally up to you, moms. So again, I know that getting ready for having your baby can be really overwhelming. Developing a birth plan, I think, is a really important strategy to work with your doctor for. I have dropped that link below. Please check it out. Let me know what you think is missing maybe, or what I could add. Subscribe to my channel, share it with your friends so I can reach more moms, and I look forward to seeing you next week.